I have a question for you. Have you ever cared so much about your patients or your team that it actually kind of broke you? Because I did, and for years I thought I was the problem. I thought maybe I just wasn't strong enough to handle the pace, the pressure, the politics. And honestly, what if the truth is it's not you? It is the system. And what if, just what if, we could change it? So my name is Diane Goodmanson, and for over 25 years, I lived and breathed healthcare. I put in a lot of time and overtime. I spent 10 years as a nurse and over 15 years as a nurse practitioner. I worked in so many places. It felt like I worked everywhere, from emergency rooms to intensive care units to rural hospitals to home care to personal care homes and private practice and walk-in clinics. But around 2016, something inside me just was ready to walk because I realized that the system that we're all working so hard to protect is hurting the people it is actually designed to help. That's our patients, right? So I did something that most people thought was crazy. I walked away. I packed up my RAV4 and I started something I called Nurse Practitioner on Wheels. So what I did was I drove to patients' homes, I would serve them in their offices, and I would sometimes see people even in my vehicle. This was in remote rural areas, also in the city of Winnipeg. And what I did was listen. I really listened to their stories. And I could see the system from outside the system because I walked away. I left my supposedly stable union job. I walked away from my retirement plan. And it was all because I just knew deep in my soul that I was meant for more. I was meant to provide patient-centered care. And so I discovered the truths when I was able to see the system from the inside and from the outside. And the truth changed everything. So when you listen deeply, and not just to patients, but to people, to staff, but to other people that you work with, that you exist with, that you serve, transformation starts to happen because this is what I've learned, is that I was out there and I realized that healing doesn't start with prescriptions. Healing doesn't start with more policies or more regulations. It starts with connection with that person. It starts with, and at the root of connection is listening. We literally cannot have good connection with people unless we listen. So here's the thing, and this is a really big truth. Our healthcare system does not have a compassion shortage. There is a connection shortage. So we seem to have a culture where leadership feels like you're pushing through, performing under pressure and surviving. Just, maybe you're not burned out. Maybe you're feeling on the verge of burnout, or that you feel like you just want to quit or leave. That's not leadership. That is pushing. That is endurance and survival. And it just is not sustainable. We're taught all of these skills and what to do and how, all this kind of stuff, but we're not taught how to be the right kind of being, the right kind of leader who is doing the things, right? And so endurance like this, survival, is not sustainable. It is silent suffering. And I believe that the greatest untapped force in healthcare is not more funding. It is not more technology or fancy clinics or policies. It is transformational leadership where we transform one person, one team, one community at a time. And when leaders transform from the inside out, everything changes because morale improves, communication starts to flow, trust starts to build, and the whole environment changes. And then what happens is when you transform yourself and it transforms your team, then it translates into patient care. Patients start to feel seen, they start to trust the system, they show up for their appointments. Maybe they're feeling seen for the first time in years. And so here's the thing. I took all the things I had learned from 25 years work and I decided to create a framework. So that is why I built the Listen framework. It is the heartbeat of everything I do, and it's so simple. We listen to people, we involve, we strengthen others, we seek first to understand, then we take action, we evaluate, we nurture, and it's a continuous process. So it's all about learning to listen. It's not just to patients, but to ourselves, to our teams. What is the system? What is the people that we serve really saying? What is the system saying underneath all the noise? So this YouTube channel, which I'm calling the Health Warrior, exists for people like me and like you who are change makers, maybe a little rebel spirited. We might even be a bit exhausted, but we still believe that healthcare can be so much better. And we just know that there's a better way. We may not know how yet, but we just know that there's a better way. And so maybe we just need to have that little bit of hope or guidance to see how that can happen. And so here on this channel, I will give you the bold truths, stories, real stories that make you think, and leadership conversations that help you to elevate, to rise, and to be a better leader. And not by working harder, but by becoming who you were meant to be. Becoming who you were meant to be. And that shouldn't feel hard, because if you become your authentic, true-natured, powerful self, then that is who you're meant to be. And it will feel easy. So if any part of this introductory message speaks to your heart, if you've ever felt unseen or unheard or dismissed or unappreciated, either as a patient or as a leader in healthcare, but you still hold on to the belief in what you know is possible, then this is your place to be. So subscribe to this channel, maybe share this video with a colleague who's ready for something different, and let's stay connected, because together we can transform healthcare from the inside out, beginning with us. So you're not crazy for caring. I must say, you are the leader that the system has been waiting for. Very powerful. So I encourage you to subscribe, to share this video, and I will see you on the channel. You are the leader the system has been waiting for.